Devin, will you join us?
Good morning. Just to kind of start off, death records are that are filed with vital records are used to initially identify potential maternal mortality deaths, which makes the accuracy of these records extremely important. The 2003 revision of the U.S. Standard Death Certificate, which actually was implemented at various times throughout the last 15 years, included what I'm going to call the pregnancy checkbox. For this item, or the pregnancy checkbox, the medical certifier, whether it be a physician, a coroner, or a medical examiner, specifies whether a female was pregnant at the time of death or within 1 year of the death. That information, along with the death record, is filed with the Vital Records Office of that jurisdiction. That information is sent to CDC, National Center for Health Statistics. It is then medically coded with the ICD code and is returned to the jurisdiction with that code. Any kind of inaccuracy of data that's reported on the pregnancy checkbox can lead to over-reporting state and national maternal mortality ratios. So in Louisiana, Vital Records and Maternal and Child Health Program have a very strong relationship, and we're normally working on multiple quality assurance projects or initiatives at the same time. Because of that relationship, we jumped on the chance to partner with CDC Division of Reproductive Health in 2016 to conduct a pilot to evaluate and assess the data that we were receiving with the pregnancy checkbox on death records. The pilot was done with 4 states and the Division of Reproductive Health. Louisiana was one state. The other states were Georgia, Michigan, and Ohio. For the pilot, each state kind of designed their own QA workflow and how things would work. And it was amazingly similar. It was interesting at how similar those QA workflows were for each one of the states, which shows that it can be easily replicated nationwide. The jurisdictions also use a standard data capture tool just so we could track this and track the results of the pilot project. And basically the main 3 topics or action areas for all of the states' QA workflows was basically data linkage, follow-up, and correction. Now, what we found in Louisiana as we went through this is we would keep hitting this. We would initially work with our maternal child health program. We would try to link any female death certificates where the pregnancy checkbox said that she was not pregnant at the time of death. So we would try to link those records with a birth or fetal death. Doing that, we found 12 deaths that were where the female was pregnant at the time of death or within 1 year of the death that was not reported to us. So those 12 would have been missed potential maternal mortality deaths. In addition to that, for the records that we received in where that pregnancy checkbox was checked that she was pregnant or pregnant within the past year, we had 78 records in 2016 that indicated that. We would then try to link those records with a birth or a fetal death record to validate that the female was actually pregnant at the time of death or within the 1 year. With doing that, our MCH regional coordinators would try to if for the non-validated records, our MCH regional coordinators would go and try to abstract medical records to determine whether the pregnancy checkbox was valid or not. Then we would in turn make the corrections on the death record and also provide that information to NCHS, and it would update our state file as well. So we had, including the 12 records that we found that were indicated no pregnancy, we had 91 potential maternal mortality deaths that were identified using these methods. Of those, 33 had the correct pregnancy checkbox selection indicated. 33 out of 91. 58 had the incorrect pregnancy checkbox indicated. That's 64% of the records that we had that potentially showed a maternal death were inaccurate. 55 of those, 58, were due because there was no documentation and the female was not pregnant and had not been pregnant within that 1 year. 3 were due to the incorrect timing that was of that the birth or the fetal death. So we took this project, and this is now part of our permanent workflow. This is something that we feel very strongly about based on the results that we got, and we now do this have done this as a permanent workflow between maternal and child health and vital records in Louisiana. We'll continue this. We did it in 2017, we're doing it now in 2018. And our goal is to identify the correct pregnancy checkbox errors at the state level before the state and national statistical files are finalized. We're also, because of some of the results of what we found, we're also changing our electronic death registration system to include more validations or other edits to prompt the certifier, whether it's the physician, coroner, or medical examiner, are you sure this woman was pregnant, at the time of death? We feel like all these actions are being done as a result of this pilot project that we did with the Division of Reproductive Health. And these results were not just Louisiana specific. I was talking about Louisiana, but each state that participated in this pilot had very, very similar results, which shows how that pregnancy checkbox and the accuracy of it can inflate potentially the maternal mortality rates that we're seeing in the country.